day, everyone. Today, our topic is about protective factor model of resilience. So, there are three models of resilience: the compensatory model of resilience, protective factor model of resilience, and challenge model of resilience. So, the compensatory model of resilience is a framework that explains how individuals can maintain positive outcome despite adverse experiences or exposures by relying on external resources or compensatory strategies. In contrast to the protective factor model of resilience, which focuses on internal and personal qualities, the compensatory model focuses on external factors that can help individuals cope with challenges. So, the compensatory model of resilience offers a different perspective on how individuals can maintain positive outcomes despite challenges. So, by focusing on external resources and strategies that can help them cope, so compensatory strategies or resources can include social support, access to resources, problem solving skills, coping skills, and adaptive behavior. So, um, by relying on these compensatory strategies, individuals can maintain positive outcomes despite adverse experiences or exposure. However, it is important sad to note nga ang compensatory strategies can be effective in short term kay they may not address the underlying causes or adversity and may not be sustainable in the long term. Next is the protective factor model of resilience. Is a framework that explains how individuals can maintain positive outcomes despite adverse experiences or exposures by relying on internal and external resources that help protect against negative outcomes. So the protective factor model of resilience is ga-provide siya og comprehensive understanding ug unsaon sa individuals nga i-maintain ang positive outcomes despite sa adverse experiences or exposures by focusing on internal and external resources that help them protect against negative outcomes. So, ang protective factors can include personal qualities, family support, community support, school and workplace support, and access to resources and life skills. So, by focusing on these protective factors, individuals can build resilience and be better equipped to handle challenges and stress. And then it's important to note that resilience is not a fixed trait, but rather something that can be developed and strengthened over time through exposure and kanang supportive relationships. Last is the challenge model of resilience. It's a framework that explains how individuals can grow and develop in response to adverse experiences or challenges. According to this model, resilience is not just about maintaining positive outcomes despite challenges, but also about using challenges as opportunities for growth and development. So, in this model, individuals are viewed as capable of adapting and growing in response to challenges rather than just being passive recipients of stress and adversity. So, the model highlights the importance of taking an active approach to challenges such as seeking support, developing coping skills, and seeking out new experiences. So, ang key elements sa challenge model of resilience kaya include ang emotional regulation, perception of control, positive self concept, social support, and positive coping strategies. So, by utilizing these elements, individuals can not only maintain positive outcomes despite challenges but also use challenges as kanang opportunities for growth and development.
This model of resilience is derived from developmental literature and systems theory. It indicates that protective factors foster positive outcomes and healthy personality characteristics despite unfavorable and aversive life circumstances. The protective factors identified including emotional management skills, interpersonal reflective skills, academic and job skills, ability to restore self-esteem, planning skills, life skills, and problem solving skills. So there is an interaction between protection and risk factor. which reduces the probability of a negative outcome and moderates the effect of exposure to risk. Ang protective factor model suggests that promotive assets or resources modify the relationship between a risk, another promotive factor, and outcomes. When we say resources, it refers to factor outside individual, such parental support, adult mentors, and youth programs that provide youth with opportunities to learn and practice skills. There are two possible protective model, which is risk protective and protective. Ang first kay risk protective model indicates siya that promotive factor operate to moderate or reduce the association between risk and negative outcomes, and then ang imuhang protective models operate to enhance the effects of either promotive factor alone for predicting an outcome.